So our paper is about the threat of the COVID-19 pandemic on the global life-saving gains that have been made in survival of childhood cancer. And it's a call for collaborative action from both my own society, CEOP, and several other healthcare professional organisations and parents and survivors of children with cancer. Our paper aims to highlight the real and ongoing potential impact of the COVID pandemic on the continuum of care for children and young people with cancer. We're in the early years of implementing the World Health Organization's global initiative on childhood cancer, which aims to improve survival worldwide to at least 60%, with the aim of saving 1 million lives of children from cancer by 2030. Now, we have been, as organizations, we've been supporting the WHO's work in several countries that are implementing the global initiative. And we want to ensure that the gains made until COVID struck are not lost because of the pandemic. And our paper is outlining how we can support the WHO's call to governments and health service planners to ensure that the needs of patients with cancer are included in COVID recovery planning and mitigation strategies at a national level. We have a vast understanding of the needs of children and young people with cancer throughout the continuum of care, from accessing diagnostics to then accessing treatment and having it continued without interruption and aftercare. And in this article, we bring together that collective experience and knowledge to cover 5 key areas that are needed to ensure that the care and outcomes of children and young people with cancer are not unduly affected by the COVID pandemic. So specifically, we cover aspects such as maintaining public awareness of the signs and symptoms of cancer in children and young people, and knowledge that the pathways in their country to access a medical diagnosis and treatment have been made as safe as possible during COVID, and that people should come forward if they're concerned, because we know that early diagnosis is key to improving survival, and late diagnosis of childhood cancer continues to be a problem around the world. The second area is avoiding interruptions in treatment. And we did collectively publish clinical guidance in April 2020 about permitted modifications to chemotherapy and timing of radiotherapy and surgery that would be expected to be safe. But in general, we suggested that treatment should continue as planned wherever possible. Now, some of the modifications in the treatment and care pathways are, of course, welcome, both by hospitals and by patients and families, such as switching more care to online consultations and keeping patients avoiding traveling to hospital if unnecessary. And some of these benefits, I think, will be continued post-COVID and are welcome. However, it's really important that that nations and health services collect data on the children with cancer in their services and keep track of what's happening to them. A third really important area is the need for psychosocial and financial support. The COVID pandemic's had a huge impact on the well-being both of families affected by childhood cancer and also the staff who care for them. And we mustn't forget this. Any COVID recovery plan needs to take account of the need for psychosocial recovery. Similarly, the financial burden has been immense on families, with many parents losing their jobs and the costs of traveling to the hospital for treatment. And again, the NGOs and parents' organisations involved in co-authoring our paper have enormous experience of how to mobilise effective support in these areas in many countries around the world. In setting out COVID recovery plans, governments and health services also need to take account of maintaining access to the essential medicines for cancer treatment, and specifically taking account of drugs needed to cure the most curable childhood cancers, such as maintaining supplies of high quality drugs such as asparaginase and other chemotherapy agents that maybe are not needed so much for adult cancer. And then finally, we've highlighted the importance of maintaining, gathering and maintaining evidence so that we know that the mitigation strategies that are being taken are effective. And also, as we look to the future, there will be outstanding questions such as who should be vaccinated. For example, should we be advising vaccination of carers or of the patients themselves? You know, even though children are thought to be less affected by COVID, through setting up a global registry with the support of St. Jude, we have documented now that there is a mortality rate from COVID in children with cancer of about 4%, which is much higher than in children in general. So we do need to know that the mitigation strategies have been effective. The World Health Organization's Global Initiative on Childhood Cancer is a decade-long initiative that aims to improve survival rates to 60% minimum, especially in low middle income countries by 2030. We are well on the way in the countries that have started to make plans and implement them to seeing these improvements. The COVID pandemic has caused a temporary interruption, but I think we now need to accelerate the numbers of countries and governments that want to take up this challenge and include children with cancer in their health service planning. So I think the COVID pandemic has highlighted the close-knit community globally that is both expert in and interested in improving outcomes for children with cancer. Back in March 2020, we were able to mobilize together to produce rapid clinical guidance to healthcare professionals right around the world in all settings of care on how to adapt their services to ensure children with cancer had ongoing treatment. I think one of the biggest threats right now is the reduction seen in many settings in the number of new cases being diagnosed. You know, this implies that children with cancer are not coming forward for medical attention in some countries and will presumably either never be diagnosed or maybe diagnosed late and with more advanced disease that's more difficult to treat. So I think a big push on ensuring that early diagnosis campaigns are not forgotten and that the public and families are reassured that their health systems have created safe access to medical assessment and diagnosis of cancer so that treatment can be initiated. We've brought together the collective knowledge of and experience of SIOP, the International Society for Paediatric Oncology, the equivalent societies for surgical and radiation oncology, the Childhood Cancer International Organization representing parents and survivors, World Child Cancer, an NGO that has programs and projects in several areas of the world, the St. Jude Global team, who have enormous supporters of the WHO Global Initiative, UICC, and the World Hospice and Palliative Care Association. And we've brought together these organizations' knowledge and advice to governments in how we can help include children with cancer in the recovery plans from the COVID pandemic.